Today I am going for my total hysterectomy and oophrectomy surgery. So hi, hello, welcome back to my channel. Today I am going to do a small talk about my experience of having total hysterectomy and oophrectomy surgery. Okay, so I hope you all have seen my previous video that I had iron transfusions, blood transfusion because I had a chronic anemia and I have nearly collapsed many times, and my HB was critically low. Then I have been posted for surgery on 31st of December. Then on that day, it has been cancelled because of my HB dropped very low than before giving iron transfusion. And I had a severe bleeding, so they cancelled my surgery, and doctor told me that I doesn't need to go for a waiting list again. They will find another date for my surgery. Finally they find another date for my surgery. That was 24th of January, Friday. So I have undergone for surgery. I went there. So before that, on that day, my previous day of surgery, they have given me tranexamic acid, tranexamic acid to stop the bleeding, mefenamic acid, and Provera, that is the medication that stop bleeding, and given ferrous fumarate 210 milligram tablets to maintain the iron level, and because and codeine tablets to control the pain as well. So codeine and ferrous fumarate tablets, as a side effect, it makes us constipation and it is very painful. Doctor prescribed a Movicol for me, so I was having that one as well. Then what was doctor's suggestion was like, they will do the blood test 3 days before my surgery and check the HB level. If it is low, they will do the blood transfusion. But on after 2 days of my previous surgery, planned surgery, I had I was having severe bleeding and I had already 2 units of blood transfusion. So my HB come up normal, are about to normal 110. So they were very happy with that. I went for a blood test on Monday. That was on, I think it was on 20, I think it was on 21, something like that. Anyway, I have very difficulty to cannulate. The doctors was experienced very difficulty to cannulate me, and maybe I had lots of blood transfusions and iron transfusion. That's another reason, and I had lots of medications as well. Tuesday, doctor phoned me and told me that the blood request form has not been completely documented, so they have rejected the pathology lab has been refused the blood test, so they need to do another blood test. So I went again on Tuesday to do more blood tests, and it has been done, but I haven't heard anything back from the doctors. Then on Thursday, I am using 3 mobile, and my husband also used 3 mobile, and our land phone wasn't working for a long time. Then because I haven't bothered to do anything because so many things happening around me, so I haven't done anything about that. So I haven't heard anything from the doctor. So on all that week my blood sugar were dropping, and I'm using the Libara, the implant, the sensor. It was always alarming that my blood sugars were dropping, and I couldn't sleep very well. I was so exhausted and tired most of the day, and sometimes I am having a little bit confusion, like sometimes I was a bit forgetfulness and all. then on Thursday, as I said, like my blood sugar were dropping all that day. Then the middle of the night, it was alarming all night as well. So 12:30, I have told my husband I want to sleep because I have to get up 5 o'clock to go for surgery, and I am nil by mouth as well. So I am going to turn this alarm off. Then I am going to sleep. That's what I said. Then I just remember, like a doctor has informed me, so maybe, and the mobile network wasn't working all that day. So my husband was calling me through the WhatsApp, and many people phoned me on that day, and they couldn't get me through the mobile, so they called me through the WhatsApp via internet. Then I thought maybe doctor left a voicemail, so I checked my mobile. I haven't received any voicemail. Then my husband checked his voicemail. Then the one of the doctor, night duty doctor, sent a voicemail that I have to go to the hospital to do urgent blood test. So I was very scared. So I phoned the gynecology ward and asked them, and they said, yeah, I need to go there, need to do blood test. So I went at 12:30, and we come back after the blood test around 2 o'clock. Then I went for sleep. Then the next morning I went there at 6:30 for the surgery. I have to be there before 7 o'clock. So my husband dropped me in the hospital. I carried all my suitcase and I went there. Then because my son has got to school on that day, so my husband has to drop him as well. Anyway, but it's all happened before that. So I went to the day surgery reception. Then I have shown the my a letter to the receptionist, and she asked me to wait on the reception area. I waited there. Then 7 o'clock, one of the senior nurse called my name, and my husband was there, and he just told the nurse that my blood sugar were very low. That was 3.6 at that time, and she took me inside, and my husband left. When I went there, she was asking me all the questions, like all my what operation I'm having, and do I have any like valuable things, what all the medication I am taking, all that questions. So I have answered all that question, and she checked my vital signs such as blood pressure, pulse, temperature, and respiratory rate. Then I have also I have got my blood sugar reading, and at that time anesthetist came to see the patient. So the nurse told the anesthetist her blood sugar is very low, and the anesthetist came and told me that because I have I have an antibody formed in my blood when I had my blood transfusion. So if I need blood transfusion during the surgery, I will have the reaction, because I can't have the normal blood transfusion. I need a special blood that need to come from Bristol, and it's not happening on the same day. You need to wait for next day. So the doctor has a bit confusion about my surgery. I was very scared, like this is my second time coming for the surgery, and I was really worried maybe my surgery is not going to be happening on that day. Then he heard about my blood sugar, that makes him worried more, because he thinks that's a very high risk, because my blood sugar is very low, and if something happened, that's another risk. So he said he need to discuss with the endocrinologist. So I said I have been referred to the endocrinologist, and they suggested me that I have to control my diet and all. And maybe I am having problem with this PCOD. When I am having this surgery, maybe I won't have the problem. That's what I told the doctor. Then my surgeon came, and the gynae consultant came as well together, and they came together. So my surgeon came over, Rashmi. They phoned me when I was sitting in my couch and said, oh, I am having again problem with the surgery, and he was very worried, and he told me that about the antibodies and things. And he said then the gynecology consultant told me that no, there's no antibody formed, so it's okay. So one thing was tick, so no problem. Then because the night time I came for the early morning I came for the blood test, so it comes back as normal, so it's okay. then the blood sugar. So I told the doctor, because sometimes Libra shows a bit blood sugar low, so if you check by blood test to the capillary, then the blood sugar will come up. So when she checked the capillary, it comes up as 4.6. So they were a bit happy, and I said, because my blood sugar always low, and especially I am nearby mouth, so please give me a dextrose, then my blood sugar will be up. So what the surgeon wanted to do the surgery today, because he was desperate and I was desperate. I was so sad. So doctor said, okay, I will take Rishmi first for the theatre. Then we'll start the IV fluid 5% dextrose. Then the hypo. I won't have hypoglycemia. That's what he said. Anyway. Everything has done, and the nurse gave me a pot to collect the urine sample. I have given, because they are checking that I am pregnant or not. I'm not pregnant, I know, but I was bleeding as well. Anyway, they just want to make sure for that. So that's all done. Then when the one of the gynae consultant came to talk to me, and I said, yeah, I think all of my organs will remove, isn't it? That's what I asked her. Then she said, I don't know, you got all the point. I said, my ovaries will be removed. Is that true? That's what I asked. And she said, no, your ovaries will be going to keep, and uterus, fallopian tube, and cervix will be removing. I said, no, I have PCOD, I wanted the ovary to be removed. That's what I said. So she went to talk to the surgeon, and surgeon came back to me, Rashmi, is that true? I said it's true. So my friend Shiny Chechi came to see me as well at that time, and he came to tell me that because you are too young, if I remove the uterus, you remove the ovary, you will have menopause as soon as we finish the surgery, and you will have emotional imbalance. You have a high risk of having osteoporosis, mood swings, and so many other things doctor explained to me. And he said he don't have any problem. I have to just give as a consent for oophrectomy as well. They can do everything in the right time. So I asked if in my ovaries, doctor show me the report that ovary is clean and clear. But I said, if I later in the future, if I have any problem in the ovary, I have to come back again and do all this surgery again. So I don't want that to be happen, because I don't want my abdomen to be cut. I don't want to go through all this pain again. So I said, doctor, no, I don't want. I have so much problem with this PCOD. So please remove my ovary as well. So he just asked me to give the digital consent. I have given the digital consent. I have discussed with my friend Shiny Chechi. She told me as well. So anyway, I'm in 43 and I will have menopause very soon. So why I'm waiting? Why I'm carrying all this risk? So she's encouraged me to do so. So it was my opinion as well. So anyway, I have given consent for the removing of my ovaries too. So by that time, the two ladies came from the operation theater, and they took me to the theater. And when I went there, I have already explained to the anesthetist that I am having very difficulty to get the vein, so very difficult to cannulate, and I don't want my right hand to be used, because I already had the iron transfusion, blood transfusion on that, and my right handed were very swollen. I was unable to use my hand for a long time, and same thing happened for my left hand, but that was a bit long time. I mean, around 6 months ago. So please use my left hand. So he said, okay, he will try to cannulate on my left hand, and if he didn't get any vein, then he only go for right hand. Anyway, when I went there, the ladies were so friendly, and they were so much caring. In here, the relatives are not coming with us, so we have to carry all our luggage. So I mean, the ladies will carry. Okay, the ladies can carry. They asked me. I said, no, I can carry. So I took all my luggage and kept it in the operation theater itself. Then they were comforting me, so that I have to remove my underwears and bras as well, because there's a metal hook. So I had to they removed everything. So they have tried to cannulate. So there was a anesthetist assistant lady was there, and she tried to cannulate me 2 times and it has been failed, and the anesthetist tried third time, and then fourth time they were successfully inserted a cannula. Then I know doctor already explained to me, they will administer anesthetic fluid through my vein, then they will give me the oxygen mask, and when I'm having anesthesia, then they will do the when I am, then they will start the surgery. So they were talking to me when they administered fluid. So they were asking me, "Oh, who is that? Your friend is Shiny. Is she's the in charge of the area? She's the NHS staff. NHS staff always working in a high care." All that they were asking. Some third question. After third question, I was unconscious. I don't know anything. Then I haven't opened my eyes. I was awake when on the recovery area. So when I wake up, and the recovery nurse was calling me, Rashmi, wakey, are you okay? Then I wake up with a lot severe pain. I don't know how to explain that pain. It's like back and my tummy was like it's not pins and needle, like I felt like thousands of needles, like what I say, piercing in my body. That was the feel. I I was in loads of pain. But my surgeon came to see me. I can hear his voice, but I was unable to open my eyes. I was unable to talk, but I can hear. He told the nurse that I can just tell Rishmi that I came to see her. If we have done whatever she asked for, so she can call me. Anytime she wants. She know how to contact me. Then he gone. Then I felt like I want to go to the toilet. I told the nurse that I want to go to the toilet. I will walk, and he said, "No, you had a major surgery. You can't walk. The toilet is very far, so we can give you bedpan." And they given me bedpan. I couldn't pass you. I couldn't go to the toilet, but I have already had the catheterization. I forgot all that. Then they were constantly give me fentanyl injection, all the medications they were giving. So my surgery took 1 hour 40 minutes, and I was in they took me to the theater at 9 o'clock, and I wake up at 4 o'clock. I was in the recovery room until 4 o'clock. So then they transferred me to the ward, that is E2. Then when they transferred me there, I had the oxygen as well. They given me 2 liters of oxygen as well. Anyway, when I went there, the nurse came to do my ops and all after 1 hour. They were so busy. The nurses were so busy, so I can understand that she came to do my ops, and there is. I was in lots of pain, so I was asking her about the pain medication and all. Usually they give a special pain medications, but they haven't given. I have the open surgery. It's not a keyhole surgery. So doctor has removed my uterus, fallopian tube, cervix, and both of my ovaries, and it's open surgery, and it's very painful. I couldn't even move at all. Then the nurses were giving me midazolam, Tramdol, or morphine, paracetamol, then what else? Oxycodone. So I have been given different types of analgesia. Even though I'm having all that, I was in loads of pain. Oh my God, I don't know how to explain that, and I was crying in pain. My husband came to see me, and my friends were there all the time with me. Shiny Chechi, Flower, Reggie Chechi, and some of the staffs from E2 as well, Malayali staff. So they were always there for me. So I have to say thanks to everyone, like who were care for me, like Sini Chechi, Shaibi, like lots of staff helped me a lot actually. So this is the day when I had my surgery. I wake up at 1 o'clock. I was in lot of pain. I was sitting up then, but I thought I will be discharging next day. I had the catheter, so but they haven't discharged me on the second day. They discharged me on the third day. Second day, Flower came to see me after her night shift, and she helped me to sit at the edge of the bed, and I feel like really dizzy, and I tried to sit on the chair as well. And I have been I have been getting food from the hospital, and it was a very nice food, very tasty. I have really enjoyed. I don't know why the patients are complaining the foods are very bad, but I felt so nice, a nice caring staff. Even I can understand it's very busy. So this is the day came, I am going to discharge. I will explain that the physiotherapist came to see me, and she find that I have some crackers, and she has been given me the spirometer. I will explain all that later. So the third day, the nurse removed my catheter. I walked to the toilet. I was in lot of pain. I was holding my tummy, and I walked slowly, and I have passed 29 ml of urine. But usually, the hospital policy is that they will discharge the patient after the patient after only they discharge if the patient has passed 250 ml of urine. But I was desperate to come back home, so they can see that, and then they did a bladder scan, and I haven't had any urine in my bladder. So I have only passed 29 ml of urine, but still I have managed to pass urine. So I said I can go home. And my matron from ED, he came to see the assess the bed, because some of the patients were waiting to get the bed. So he knows two of the patients are going home, three, so including me. So then he realized it's me. I was the one admitted in the ward. So I said, no, I have passed urine. I'm going home. I can go home. And my TTO means the medication that doctor prescribe for me to take home. So it need to be screened, then they need to be sent to the pharmacy, then we can collect. So the nurses were asked me, like, I can go to discharge lounge. That's a place where the patient can go to the area when they are discharged, so they can wait there until their medications ready. So I said, no, it's okay, I can go home, and my husband can come and collect the medication. So and I couldn't walk that far, so my husband requested a wheelchair to take me. And by that time, it was lunchtime. It's nearly 12 o'clock. So my blood sugar started dropping again. So I had my lunch. Then the porter came with the wheelchair, and my husband said, it's okay, you can leave it. We will take it. He will wheel me to the main entrance. So what happened means, I had my lunch. Then my husband wheeled me to the main entrance, and Reggie Chechi's husband came to pick us. Then we came back home. When we come back, our friends Simon, Chetan and Chechi was here. When I woke, I felt like I'm having tachycardia. I was in lots of pain. When I came, they just helped me. They asked me to take a deep breath in and out. Many people supported me. Then Reggie Chechi and her daughter was here. She just gave me a strip wash, and they helped me to have the food, and Shiny Chechi came to give some food. They all support me actually for my recovery. My friends supporting hands is a played a crucial role actually, because when you leave abroad and your family is not there, then you really need help from your supportive friends. Actually, I'm so happy, and I am so proud about my friends. They really helped me, and still they are supporting me, okay, because passing through a very difficult situation because my husband mom, that's my mother-in-law, is not very well, and my husband was so much tensed, and unfortunately he has to go to India, and I told him to go because she is not very well. So he was really worried because the time he went to India, it's only 1 week, and I am not supposed to do any lifting, any cooking, any bending, nothing. But that's why he was worried. But I encouraged him to go and see his mom. Why I said, like, I mean, because I know my friends are here to support me all the time, so I wasn't worried, and the hospital is just nearby, and I am a nurse, and I know what's happening, and the pain will stay for a bit longer, and I'm having lots of medication. So I thought he needed to go to India, and I can get the support from my friends, so I let him to go. So what I say. So the when I forgot to mention something. When the physiotherapist came to assess me, she mentioned that I have a cracker. So she gave me the spirometer, and she asked me to use that one. I will upload another video how to use the spirometer and all. So she said. You need to do that exercise, and she didn't help me to walk because I already tried to walk and sit, then I have hypertension. So she said it's not very good to do it again because I already tried 2-3 times, and she said you are a nurse, you know how to do it, and she was very happy. Anyway, I haven't get the discharge on the second day, I have the discharge on the third day. Anyway, that's another thing. So when I come back home, the doctor gave me only codeine, ferrous fumarate tablets. I had a ferrous sulfate tablet. Then sorry. Then I had a hormone tablet because my ovary has been removed, so I need to take some hormone tablets. Then lactulose to prevent the constipation. Then what I had, so I couldn't control my pain. So when I phoned the doctor asked me to have ibuprofen and paracetamol. What else I had? I think that is only medication I got after discharge, but that wasn't enough. So I was in agony for few days. But I will explain all that in another video. I think this video is a bit long. So this is my surgery day 1 to 3, and I will come back with my more experience about the hysterectomy in another video. So Flower and her son and husband came to see me, and this make me a little bit cheerful. And yeah, I mean, when you are passing through a difficult situation, your friends supports are very very important, because when you are emotionally, physically drained, then you really need somebody near for you. Okay, near you with the support. Okay, this was my blood sugar always dropping, and but I look so more pleasant after my surgery. Even though I am in pain, I have some time that pain free, and even I was getting pain medication through the 4 hours. Anyway, thanks for watching my video. Bye bye and take care.